Laura, thank you so much for being here today.
You're welcome.
Jasper, representing Health Healers, and for taking some time to talk about our relationship at Horizon and this lovely setting at Menominee Park. Laura, tell me a little bit about your organization, Health Healers.
Sure. Health Healers is a professional therapy dog service. We provide therapy dog program design and implementation. We train therapy animal teams, that's the registered therapy animal, often a dog, and their handler, and provide training for them, and then we provide training to professionals who want to incorporate therapy animals into their scope of practice. So whether it be counselors, occupational therapists, physical therapists, educators, and so on.
How did you come to work with hospice?
Well, hospice has got a real special way that the patients can benefit from the therapy dog presence and therapy cats. There's a calming effect and a peace that comes to the patients, I think, when they're connecting to a therapy animal. And so it seems like a real natural way to enhance the quality of life for people that are going through that phase of their life.
You and Health Healers and all of the wonderful pets and people that you work with have been helping Horizon patients and their families and our staff for about 5 years.
Right.
And I've been able to see them in action personally. Tell me a little bit about a day in the life of a therapy dog and their handler.
Sure. Well, there are 5 therapy dogs and a therapy cat that spend time on the Horizon unit, up on the Lawless unit. Well, there's Toto, and there's Caesar, who is a Shar-Pei Husky mix. There's Juliet, the therapy cat. There's also our smallest dog is Bella. She's a small white dog, a Coton de Tuilier. And there's also Lincoln, a golden retriever, who comes on the unit. Some of the animals get up on the beds or on chairs next to the beds for patients so that they can be stroked and petted, even if a patient might be weak or have limited mobility.
And my favorite, of course, is when patient and pet reverse. Pets in the bed, patients in the chair.
And that has happened. That has happened. So I think Elliot, the Whippet, was on the bed one time at the patient's invitation, and the patient was in the chair, but able to easily reach Elliot and pet him. So yeah, that was quite a time. So they spend time, as much time as the patient might need. It just helps them feel comforted, feel more at ease. It certainly provides more of a family kind of environment, or a
something
home
that's more
environment.
natural. Tell me a little bit about the physiological benefits that are realized through this type of therapy.
There are tremendous benefits, and science is really starting to recognize not only that therapy animals can make a difference, but how it is that that happens. And everything from blood pressure decreasing, heart rate decreasing, lung pressure is decreased. The feel-good hormones, so things like oxytocin that really make us happy and feel warmth, those hormones are elevated very quickly in the presence of a loving therapy animal. The stress hormones are decreased significantly as well. So there's a lot that's going on in our bodies that impacts how we feel and how we act and even how we think and move. All of those things are benefited and heightened because of a therapy animal.
Well, and we're so happy to see the benefits to our patients, to their families, but as I said, our staff too. Our staff who, they deal with some pretty heavy issues and emotion and people who are in crisis, so it's so nice for them to have a break in their day and have a little benefit from therapy dogs or the therapy cat.
Yes. All of the therapy animal teams that go through Health Healers have to follow the Pet Partners standards. Pet Partners is the leading national organization that registers therapy animals, and we follow their gold standards and in addition add some additional protocol of our own. So for example, often handlers and their therapy animals will pass the therapy dog evaluation. Usually that's after taking classes from me to prepare.
So that's the key.
They're very successful in the evaluation.
There's a little prep that goes into it.
There is prep. But as importantly, after they become a registered therapy team, instead of just going out and volunteering somewhere where there isn't a lot of direction or support or knowledge in the area, All of my teams have to go through additional on-site training to be able to participate in programs, and I am continuing to provide ongoing mentoring to all of them and stay very connected to them and what's happening, so that we can always provide the best service, the most quality interactions and quality programming possible. A time I remember with a woman who was on hospice for some weeks, and since we have therapy animals there almost every week, she met most of them, if not all of them. And one time when Juliet, the therapy cat, was visiting, the patient just laid there with Juliet on her stomach, at her request. Again, we always want to be sure that the patient, we're providing what they want. And she just laid there and stroked the cat with this soft, gentle, beautiful smile on her face for, it was probably an hour. Oh. And at times she dozed, and she would wake up again and smile and stroke the cat. It was beautiful.
What's your favorite story of all the stories
that's
that
probably,
you've collected?
That's probably one of them. That's probably one of them because I was able to be there and witness it.
I think it's almost as much for the staff as it is for families and the patients.
Right. I agree. The medical director on the Lawless unit loves the therapy animals when they come in. And I've seen him with Toto. Toto is one of our therapy dogs. He's a Basset that came from Kansas. That's why he's called Toto. But he's lost both his eyes. And so he's a real special dog that kind of captures the hearts of staff and patients and so on.
Well, we're so happy to see the benefits to our patients, to their families, but as I said, our staff too. Our staff who, they deal with some pretty heavy issues and emotion and people who are in crisis, so it's so nice for them to have a break in their day and have a little benefit from therapy dogs or the therapy cat.
Yes. Work with people in the community in their homes, whether it be a nursing facility or hi, there you go.
Hi. Are you gonna smile? Can you smile? Can you smile and sneeze at the same time?